I'm Kinsey Strine, and I'm going to be talking about a clinical experience that I encountered a few years ago and a little bit about what was involved with my experience and who took care of me. So, my sophomore year of high school, I did gymnastics all my life, and so my sophomore year of high school, I was competing and I was doing a tumbling pass, and I landed on my neck. And so basically this put me unconscious. I was like blacked out. Whenever I awoke, I couldn't move my neck. It was very stiff and my body just like didn't feel right. So I went to the doctors, and the doctor and a few nurses did an assessment of me, and my neck was fine. It just like had a little bit of like swelling, and I had a severe concussion. So basically, the sports medicine doctor and a couple of nurses assessed me and my condition, and basically just like helped me throughout this whole process. And during this encounter, I mainly only had a sports medicine doctor and like 2 or 3 nurses taking care of me. But then after I was done with like all my doctor visits, I had to go to physical therapy. So then I had a physical therapist that was taking care of me and like making sure my neck was fine and helping me with my concussion. And I believe having just these like a doctor and a few nurses was definitely very beneficial for the severity of my condition. But also, I don't think many more like healthcare providers were needed in this instance, because yes, it was like a severe concussion, but it wasn't something that needed like high medical care and a lot of hands and like people working on like me. And I think if I was someone that came into the hospital with like a brain bleed or like needed surgery or was like bleeding internally, definitely a lot of like nurses and doctors would be needed for that. But for my condition, just one doctor and a couple nurses to like help the doctor however was needed was definitely very beneficial, but no more was needed. um and doctors and nurses took very good care of me, and they were very responsible and made sure I was like trying to get better, but also like helping with my condition. And the doctor mainly was the one doing all the assessments, and like he had all the knowledge of what was happening and like how to help. And the nurses just kind of helped the doctor however was needed, and basically just made sure I was more comfortable and just like helped me in like whatever way was needed. And then my physical therapist basically just like gave me exercises and just helped me get my body like back to its normal condition, and helped my concussion so it didn't get any worse, and basically just like helped me through the whole process like after I had to stop going to the doctors. And this was definitely very beneficial to get me back on my feet so my condition didn't get worse and that I could like potentially go back and compete in gymnastics, which was definitely very good. And not everyone has like a good healthcare experience whenever they go to the doctors. Everyone goes to the doctors for like different reasons, for like different treatments or assessments, and it all like just depends on like your experience and like who your doctor is and who your nurses are to like have like a good experience with them. And but usually they do take really good care of you, and they are supposed to work together to like get the job done and like make sure you do get better. And I was very glad that like my nurses and doctors and like physical therapists were all working as a team to like get me better instead of like working against each other, because that could have made it everything worse.